All right, Dan, our 10 News cameras are giving you an inside look at the special unit created at UCSD Medical Center to treat patients that are showing signs of Ebola.
This comes just 1 week after nurses said they weren't ready to handle the threat. New at 5 as 10 News reporter Candace Crone explains why only some will receive the high-level training.
The UCSD Medical Center has a special unit on the second floor specifically designed to help patients with Ebola-like symptoms. More than 50 volunteers have already been trained to help the patient the moment they walk through those doors.
This is where people first start putting on the PPE.
Inside this room is where hospital staff suit up in full body protective gear before walking past this warning sign and into the hot zone.
You guys need any supplies, or are you good on everything?
Nurses watch through the glass of a sealed-off room to monitor the doctor and nurse treating the dummy patient. We followed Dr. Jay Doucette into the room where he pointed out these filters attached to the medical team that are designed to make sure they don't overheat.
Basically, it blows cold air over the top of the person, down their face and out over their neck and chest. And by doing that, it keeps the person cool.
Staff can perform blood and other tests and dispose of waste all in the same room. Dr. Doucette says if an infected patient walked through the hospital doors, they are prepared to safely treat them.
We've got about a little over 50 people trained. We like to have closer to 100 trained, all of our volunteers trained, but we could take one now if we had to.
But some hospital workers disagree.
But there needs to be more hands-on training.
On Tuesday, nurses who work at the hospital held a press conference outside saying they haven't received the necessary training or equipment to handle Ebola patients. We asked Dr. Doucette about their concerns. He says the hospital has had a number of staff forums and says only those who volunteer will get the training needed to work in the infectious disease care unit.
If you don't volunteer, you're not getting the high-level training to work in this unit. And the reason we need volunteers is it does take more time, it takes some commitment, and not everybody's suited for this kind of work.
Reporting in Hillcrest, Candace Crone, 10 News.